Good afternoon to all. Hoping all are well and doing practice. And soon dietary exam already started, and we are getting also the recall, which are giving from the communication and the long case as well. So better always communication as it repeats. So better to focus on that topics. So hoping with strong practice, passes is really very easy to pass. So we'll start today a long case consultation according to our polling active inactive candidates wise. So first of all, I'm seeing in my poll active candidates Dr. Deepak. Okay, if Dr. Deepak is not here, Dr. Sumbul, Dr. Deepak and Dr. Sumbul is not here. Fine. And other candidates, Dr. Sadia Ali, Dr. Ahmed raised hand. So as far I'm seeing in my polling, Dr. Ahmed, okay, right? Okay, doctor, fine. So Dr. Ahmed, you can unmute and we can start our first clinical consultation case. Are you here? You can unmute yourself and you can start.
Yes, I am. I have unmuted myself.
Okay, Dr. Ahmed. So you, your full name, please, because in my poll active candidates regarding your Ahmed. Okay. Okay. I'm seeing your name also. Yes. So in real exam, yes, it is 20 minutes, 14 minutes, and there is 1 minute will be gap, but I'll give you 3 minutes for preparation because it depends whether it is associated communication or what else according to the station. So I'm giving you 3 minutes for preparation. And always I suggest for each candidates that do a structure wise preparation, and always outside of the exam, take a paper and do a note what you will do according to the approach. So I'm giving a scenario and make a note, do proceed according to the serially, like what you do and what is important to us, what you must not do. This way you will start. So Dr. Ahmed, I'm giving 3 minutes preparation time. Let's start.
Yes.
So Dr. Ahmed, let's start.
Hello, I am Dr. Abdul Hamid, one of the doctors in the unit today. May I confirm that you are Mr. Michael Jack, 35 years old?
Yes, doctor, I am.
Mr. Michael, I am here to ask you some question about your health condition and to examine you. Is that okay for you?
It's fine for me, doctor.
Okay. During our discussion, I will take some notes and be sure that everything will be confidential. Okay?
Yes, sure, doctor.
Okay. What brought you to the unit today, Mr. Michael?
Yes, doctor. Actually, I'm very much afraid regarding my back pain. And I'm really much afraid that what is going on my back, as I'm a young adult. So what happened?
Yes. I am so sorry for that. Be sure that we are here to figure out what's wrong with you and to help you. Could you tell me more about your back pain? When does this start exactly?
Doctor, it was started 1 month, but it was really, it's not much so worse, but it is now ongoing in worsening, so that I'm very much afraid. And for that back pain, I'm even taking some painkiller, but it's not improving so much. So that's just very much annoying to me.
I'm so sorry for that. And before this 1 month, do you have any back pain before?
No, doctor.
Okay, does it start suddenly or gradually?
It's started gradually, so I didn't care about that. I was thinking it may happen due to some strain as sometimes I do exercise, but I didn't take care. But nowadays, I'm very afraid that even I do any work, it is very much worsening.
I'm sorry for that. And is it increasing day by day? Yes?
Yes, you're right.
Is it present all the time, even at the night, or sometimes not present?
It always at the time, even at the night, it's not an issue. Issue is that when I do any work, it's worsening.
I'm sorry for that. And if I score it from 0 to 10, 10 being the most severe, how do you score it?
Yes, doctor. Initially, it was like 2 to 3, even 3, 4, but nowadays it's 6 to 7.
I'm so sorry for that. Do you want to give you any painkiller now, or can you continue?
No, I already taken in my home, so you can continue, doctor.
Okay, and Mr. Michael, what is the character of this pain? Is it shooting pain or electric or what exactly? Compression?
It is dull, doctor.
Dull.
Always clear.
Where is the site? In the upper part or the lower part of your back or mid back?
It's a lower back, doctor.
The lower back. And do you have any trauma or injury before this pain?
No, no, doctor.
Do you observe that it improves with exercise or with effort when you move?
I said you, doctor, I cannot do any work, and I need to do work is a physical exercise. So whenever I try to do any work, it's worsening. It is my
And
concern.
anything make it better, such as rest or relaxation or medication?
Yes, doctor, whenever I'm taking it, I feel good. But yes, sometimes painkiller was improving, but nowadays it's very much worsening. I have to take more painkiller nowadays.
Okay, I'm sorry for that. And do you observe any tingling or numbness on your legs or loss of sensation?
No, doctor?
Did you lose the control of your bowel work or water work?
No, doctor?
Do you have any weakness in your legs or anywhere?
No, doctor.
Do you have any wrist temperature?
Where, doctor? I didn't feel so. But sometimes I have sweating at the night. I feel so.
Sweating at the night. Okay. When does this start, this sweating? When does it
It's
start?
on and off. Yes, it's on and off. I feel sweating. I don't know why.
Okay. And did you have any contact with animals recently?
No, doctor.
Okay. Did you
I
drink
work in a dairy farm, but always there is the animals. There's not a recent issue. It is for around 4 months.
Okay. Okay. And do you drink unpasteurized milk?
I have to, as I am a worker in a dairy farm, so I have to check that was in going.
Okay.
So it is my
Do you
work.
Okay. Do you travel recently anywhere?
Yes, 1 month back I was in travel.
Where is exactly where travel?
Yes, it was in the Salada.
Salala in Oman, in Gulf cities, or what?
Yes, doctor. Yes, doctor.
Okay, okay. And I am sorry to ask you, do you have any any casual relationship,
No, doctor.
any needle sharing,
No, doctor.
any tattoos or skin piercing,
No, doctor.
any blood transfusion?
No, doctor.
Okay. Do you have any change in your weight?
No, doctor.
Any lumps or bumps anywhere?
No, doctor.
Okay. Any mood changes or sleep change?
No, doctor.
Okay. And did you lift any heavy weight at this time?
No, I didn't have any kind of the weight. No.
Do you have any skin rash?
No, doctor.
Okay. Do you have any stiffness in your joint stiffness?
The stiffness you mean I feel jam, right? No,
Yes.
I didn't feel so.
Okay. And do you have any changes in your eye, in vision or greatness or redness in your eye?
No, doctor. No, doctor.
Okay. Any change in your bowel habits?
No, doctor.
Okay. Any change in your water work?
The water work is good, doctor.
Okay, very good. And Mr. Michael, you told me that you have no mood changes or sleep changes, yes? Any cough at
No,
all?
doctor.
Any cough at all?
Cough. No, doctor. No, doctor.
Have you coughed up blood?
No, doctor.
Any difficulty combing hair or rising upstairs?
Yes, sir. The rising upstairs due to the back pain, I can't. It's difficult. I need to take rest. That's it. But coming here is fine for me. It's not issue.
Okay. And you told me that there's no skin rash or tightness or any skin change, yes?
No.
Okay. Do you have any other preference?
No, doctor.
Okay. And regarding your okay. Do you have any difficulty swallowing?
No, doctor.
Okay. Do you have any racing pacing of your heart?
I didn't notice.
Do you have any recent procedure such as dental procedure or surgery?
Surgery was 6 months back.
Sorry?
Yes, there is a surgery 6 months back.
Which surgery you have done?
Yeah, it is due to the appendectomy, due to tummy pain. There was 6 months back that it done fully, completely okay. I was really fine, and I always in checkup. There's no issue at that time.
Okay, very good. But you don't have any afterward, any recent procedure after the appendectomy or surgery? Yes.
No, no.
You have any allergy toward any medicine or any allergy?
No, doctor, is fine.
Okay. How many years do you drink alcohol?
Yeah, occasionally, doctor, with my friends.
Okay. Any binge drinking?
No, doctor.
Do you smoke?
No, doctor.
Okay. I am sorry to ask you a question asked to all my patients. Do you use any party drugs?
No, doctor.
Okay. And any family history of similar condition?
My mom has some joint issue, and she's fully now completely okay. I don't know the diagnosis actually.
Okay. And anyone else, any family history of cancer, of note?
No, doctor.
Okay. And what do you do for living, Mr. Mike?
As I said, I'm work on a dairy farm. It recently started.
In a farm? Recently
Dairy
started. Yes?
farm. Yes, I said you. You
Dairy
asked me
farm or
before. The
farm or
dairy
your
farm. Yes, dairy farm.
what's your exact work? Is it office work or what?
Yes, sometimes I need to visit some farm area. I have to sometimes taste some milk, and that's it. Yes, office work as well, as I have multiple activity I have to do there.
But you get good contact with cows and buffaloes and animals, yes?
I never sure about that. I have to always take care about them because it is my work, right?
Okay, okay. Okay, Mr. Michael, are you on regular medication?
As I said that I'm taking nowadays more painkiller.
Other than the painkiller, are you on long-term medication?
No, doctor.
Okay. May I examine you, Mr. Do you have any long-term condition I should be aware of other than the back pain?
No, doctor.
I'd like to examine you if you don't mind. I will start by vital signs for any rest temperature or any tachycardia.
It is as outside, doctor.
Okay. I'd like to examine the back. Can you look, feel, move? Any tenderness? Do you have any pain? I will be
Aspect.
gentle while examining. Any redness?
Okay.
Any
There is no
fistula?
redness. No
Okay.
redness there.
Any deformity? Any deformity?
No
Okay.
deformity, doctor?
I will ask the patient to move, bend his back forward and laterally for any limitation
And
of
it's
movement.
difficult. There's a difficult and there's a pain. Sorry, there's a painful.
But no deformity. No deformity is, such as scoliosis or loss of lumbar, yes, or kyphosis.
No deformity.
Okay, and then I will put my hand to see the tenderness is very gentle. Okay, and then I will ask the patient to do plantar. I will do the plantar, Babinski sign for in the legs, and tendon jerk for any hyperreflexia or any upper muscular relation. Okay.
Okay, all are normal.
Okay, I
Anything
will
else,
ask.
doctor?
Yeah, this the plantars, and yes, also I'd like to examine the saddle area if possible for sensation, loss of sensation on the saddle area, and also for the power in the sides, power in the sides and the leg. Okay.
Okay, doctor.
And do you have any? You told me no change in sensation, tingling, or numbness in your legs. Yes.
No. 2 minutes left, doctor.
Okay, I'd like to continue my examination by examining the heart. Okay, and
No need,
continue
doctor.
Okay, general examination of eyes and mouth for any redness of the eye or pallor and any mouth sores.
What you want to see in the mouth sore? There's no mouth sore, and in the eye there's no pallor.
Or
Anything
jaundice.
else? No jaundice there.
Any hepatomegaly or splenomegaly?
No need.
Okay, what is your concern, Mr. Mike?
Doctor, my concern is it serious? And do I need any against surgery for this back pain? As I heard from my friend that there is a need of the surgery. Is it true?
I appreciate your concern from what you told me and examination. It seems that you have a condition, most likely you have few possibilities. One of them is brucellosis, which is infection or bug from the contact with animals. And it could be serious if left untreated. Regarding surgery, no, it doesn't need surgery. After we confirm diagnosis, we'll start you on medication, antibiotic, and we need now to do for you some blood test and some imaging on your back to rule out any other diagnosis and refer you to infectious cells team or bug team and other specialists. And we need to start you on, after confirm a diagnosis, start you on antibiotic after we confirm it is brucella, which is you contact you with animals. Do you have any other concern, Mr. Michael? Mr. Michael,
Yes,
do you drive?
No, time is up. Thank you. Time is up. I'm giving you 1 minute for recap, and I will start after 1 minute later. Thank you. So now summary and question answer session. So doctor, can you tell me what are the positive findings in your cases, like examination along with that communication? What you taken?
Yes, positive finding. This Mr. Michael, 35 years old, he complained of symptoms suggestive of mechanical back pain. The positive in the history, he has contact with animals, so I suggest zoonosis in the diagnosis. He has back tenderness, which seems mechanical, which worsened by movement. Started about 1 month ago and worsened. He has night sweats or sweating, especially at night. Otherwise, negative, I didn't find any red flags, neurological manifestation for compression manifestation on his lower limb, or any other red flags. In summary, this patient most likely have zoonosis or brucella causing his back pain.
Any differential, doctor, do you have?
Yes, top of my differential is brucellosis in view of the contact with animals and night sweats. Other differential could be tuberculosis also is one of the differential, but this is less likely because he has no contact with TB patient, but still we need to rule out tuberculosis. Other differential also could be discitis. He has a recent operation a few months ago, but this is also less likely because discitis staph discitis will be more acute than this. Other causes will be less likely, such as disc prolapse, or because I didn't find any neurological manifestation. So most likely this infectious cause on the top is brucella, and less likely tuberculosis or staphylococcus.
Doctor, how you'll investigate your case?
Investigation, apart from basic routine blood investigation, complete blood count, yes, I'd like to do the inflammatory marker, ESR, C-reactive protein, kidney function test, especially reactorite, liver function test. I'd like to do X-ray on the vertebra or back, and may also consider MRI on the back. I'd like to do specific investigation for the brucella serology, and I'd like to do also blood culture, and may need also to do bone marrow aspiration or bone marrow culture specific investigation for the brucella. Otherwise, I will may add. Yes. Continue.
If your patient say that I have some urinary incontinence, what do you suspect for that?
If he has urinary incontinence, I will suspect compressive manifestation. May have lymphoma.
For that reason, what you will do?
For lymphoma, I will do first the MRI on the spine or vertebra to rule out any compressive manifestation. And I will do also urine analysis and urine culture and sensitivity to rule out any infection. And for lymphoma, I will do the MRI on the spine. But he doesn't have.
So tell me how, yes, you're right, doctor. And how you will manage your case?
Management include patient education, counseling, multidisciplinary team, including the rheumatologist and the sexual science team, and the physiotherapist, and may also occupational worker and social worker. And start him after confirmed diagnosis. We'll start him on a specific antibiotic for brucella, and if he has any fever, antibiotic, and also if there is vaccination toward the brucella, we can give him the vaccination and avoid unpasteurized milk or contact with animals as much as he can. But I will start him on antibiotic specific for the brucella after confirmed.
Which antibiotic you want to give?
Specific for the brucella, rifampin based antibiotic, triple antibiotic, rifampin. We can add the streptomycin if it is available or if it is not contraindicated, and we can add cotrimoxazole or other all oral antibiotic if he didn't want streptomycin as injection. We can add triple antibiotic.
Thank you, doctor. Time is up. Thank you, doctor. Yes. So thank you, Dr. Ahmed. Your performance is really very organized and appreciated. Yes, very nice. Thank you for your performance. So now the marking distribution according to the real exam, what we'll face actually. According to the examiner, the marking distribution will be the according to the examiner. Always it is the depends how I am feeling. So it is reality. My examiner is feeling what they are feeling, it is reality. So sequence of the taking examination was appreciated and nicely organized way. All approach was very nice. Regarding the clinical examination skill, the regulator already he tried to exclude there is a seronegative like psoriatic arthritis, reactive arthritis, enteropathic arthritis. So I'm not cutting down anymore. So clinical communication, there is a 4. And regarding the clinical communication, though few point, if I always said that it is a feeling of the examiner, how they are feeling, right? They are giving the marks to, so some hurriness was there, though I'm giving the 4, but there's some point where Dr. Ahmed means there is a social impact. As I am a worker in the dairy farm, right? You didn't ask or you didn't refer me that it is the work which is main causing factor for having this ascites, so that job relocation, social support, any occupational support we have to do, avoid this kind of the exposure. As I said, what was the previous, I said it recently in tears. So what was the previous job as well? So how many frequently you have to expose this, is the shaking of the meal. So in details occupation, that it is really as a brucellosis decide as it is the top of the diagnosis, you have to evaluate each question. There is salala, there is exposure where what you did at that time, right? You ask the sexual history is appreciated and there's no mark will be cut down, but occupation related question you didn't ask me. That's the point. Okay. As it is recently started and he need to stop. So you have to counsel your patient that I'm sorry to tell you that it is the exposure of this kind of the raw milk, exposure of this animal. So you need to avoid, or if you need any help, we can add with you the occupational health department. So this clinical communication, either 3 or 4, it again I'm telling it depends on the examiner. So identifying physical sign apart from the tenderness, you didn't do SLR test. So I'm giving you 2 because it is important. Doing the SLR test, even the examiner will tell you do it and it is positive. SLR test you didn't do. See, straight leg raising test. Straight leg raising test you didn't do, and there is also a finding there, you miss it. You just check bending forward, you are checking the general examination, urethritis, uveitis, oral ulcer, fine, it's already fine. But according to my case, as I'm suspecting it is a discitis, you did neurological examination, fine. But first of all, my brucella related, first up to down, uveitis, oral, then checking the any tone power reflex, any abnormality, neurological evaluation, SLR test, checking the site, any erythema, any tenderness there, bending, flexion, extension, so must. So SLR test is very important, any kind of the discitis related scenario. Or you can offer, sir, I want to do it. If examiner say no need or there's a tenderness, so fine, you are avoiding, you are carrying your mark. First, I have to pass my exam, that's the point. So carry maximum mark from this long clinical case. I always suggest how to pass easily the PACES. Be technician very fluently and carry more mark each skill. Okay. So SLR test is a very important, which you missed. So I'm giving 2. So regarding the physical examination, again, I'm giving, as you missed on the SLR test, it could be 3 or 2, it depends on the examiner. As I keep it positive, that's why I'm giving you 2. Okay, Dr. Ahmed. Regarding the differential diagnosis, you are getting full mark. You said it could be tuberculosis. You said it could, you should say sequence wise. You have to impress your examiner, doctors. Always try to impress the examiners. The sequence wise question, try to mute my doctors. Whenever this still feedback is not completed, then I'll take the question, inshallah. So first of all, there is a possibility that this site is a brucella. Second, it could be tuberculosis, but tuberculosis, any contact with a sick person, this question didn't ask. Second of all, I rule out the seronegative arthritis. The peer question like psoriatic arthritis, reactive arthritis, enteropathic arthritis, I ask every question. So actually, really, Dr. Ahmed asked every question. So there is no question will be, there is no mark will be cut down regarding the differential diagnosis. So I said always try to be very fluent. So I did this point. So okay, fine. So you are carrying full mark in the differential diagnosis. Managing patient welfare and the concern and clinical judgment. Clinical judgment, rifampicin, doxycycline, fine. You can say this way. But again, I said always try to impress your examiner. How? Right? First of all, support. My patient's condition, my patient is very much, right? There is back pain. How is impacting the daily life? Do he need any kind of the support? So social health worker, occupational health worker, if patient need help resting, will start the supportive treatment, physical therapy, physiotherapy will involve the infection control, medication. So always sequence-wise approach is a mandatory in the PACES. The time is 15 minutes, or if it is 40 minutes altogether. If you approach yourself sequence wise or organized way, there will be no question, no mark will be cut down. So I need it, right? I need full mark. So regarding the clinical judgment, the sequence wise investigation and management, always it depends. You said CBC for the inflammatory marker, Bussela serology, you did everything, but the management regarding the confirmatory and there is the occupational social, this way you didn't approach. That's why I'm giving only 3. Regarding the clinical judgment, managing patient concern, is it serious? Do I need surgery? Yes, you asked or you answered me. Actually, there is another 2 question also. So my suggestion till now from diet 3, diet 1, who are my nearest one, they are failing only for 1 or 2 mark in the concern. It is not accepted. It is very painful regarding the concern. Full all are the passing, on the concern missing. It's really painful. So concern. Ask, do you have any concern? How can I help you? Do you need any support? It is not necessary to do surgery right now. We are here to help with this kind of the word. Your sympathy, your empathy. Yes, you think, ma'am, it is the communication, not a long. Why? It is your feelings of your patient, right? So this way we have to show the concern. Even 2 to 3 question long clinical concentration, there's a lots of concern. Do I need surgery? On what you do? What is your management? Do I need admission? Though patient don't have any kind of the neurological features, so no need, maybe patient have admission. So this type of the approach and showing the examiner you are a confident candidate enough for the pass of the passes. So Dr. Ahmed, clear. So around you will get like 24 or 25 marks in that long clinical case, but overall your performance really appreciating and performance also very good, Dr. Ahmed. Thank you, Dr. Ahmed. Any question? Question answer.
Regarding the straight, I have
Yes.
question. The straight leg raising test. I have heard that I should do it if I found any neurology. I mean, if there is disc prolapse.
Tenderness. If anything, you have to offer it, must, because I kept it positive here. You have to offer it. Sir, do I need to do, or do I proceed? So if say yes, so you can do it. Neurological prolapse, but you have to utter it. Okay, you have to utter it. Okay. Any question, or I'll proceed for the back pain. Back pain in details.
Thank you.
About spondylitis,
yes.
I will mention it also here as differential diagnosis or
I'm not getting the question, unfortunately. I'll start the discussion, inshallah, after my discussion of the full back pain. Okay, now I'll take the question. So this is the summary of our clinical case, what we discussed. But back pain, which is yesterday even in Pakistan, Rawalpindi also there is a back pain scenario. So remember, doctors, sciatica regarding the vascular necrosis, steroid related, even they can give as a surrogate. Even they can give as a surrogate. No need to be definitive physical sign over there, because they can say, okay, do think is a positive, or patient are just like acting. So back pain scenario, as it is common and very easily we can get mark. I always suggest try to get most mark in these cases, because sometimes abdomen may not good, sometimes cardiology may not good. So I can get more mark from this long clinical case consultation. That is my safest point. Okay. So back pain scenario, doctor, stiffness. So we have to ask it first, does it improve with the exercise? Okay, fine. So you see, if it is yes, inflammatory, so there is a ankylosing, there's a Banomyces of pair, psoriatic arthritis, ankylosing spondylitis. Still, these cases are coming nowadays. Reactive arthritis, enteropathic arthritis. If it is no, then trauma, tumor. Dr. Ahmed nicely asked regarding the trauma. And the question I asked regarding the compression incontinence, this is exam real question. If you suspect there is a compression feature, what you will do? First of all, I have to confirm it by doing MRI. Then I have to call the neurologist. If it needs surgery for the decompression, you have to take in details for the examiner. So I have to carry more mark. That's my point, right? That's my point. So I have to carry more mark. So be confident and fluent according to the complaint. What is the patient's complaint? As this site is, there is occupation related, as I said, dairy farm. So you have to specifically question how it is impacting. Are you doing your activity? Better to avoid. If you need occupational health worker will involve them. This way you have to proceed. Regarding the regarding the mechanical, so trauma, tumor, osteoporosis question, and osteoporosis scenario will be also very common in the PACES exam. So regarding the Socrates neurological science symptom evaluation, urine and passage control must ask, and Dr. Ahmed nicely asked all questions. So the summary of the back pain regarding is it mechanical, is it inflammatory, or non-inflammatory? According to that, we have to proceed regarding the back pain scenario. So any question now, question answer session. What was the questions, doctors?
What test will do this clinical to exclude spondylitis, ankylosis?
Initially, first of all, inflammatory marker, right? So first of all, inflammatory marker, CBC, SRCRP, then do X-ray for the sacroiliac joint. As I said, it's a lower back pain. If it is any compressive neurological evasion, so we can do the MRI. So it depends according to the symptoms. Spondyloarthropathy, how my patient presented. That my case, Dr. Ahmed did that the presentation only tenderness, and it is ongoing in nature. Dr. Ahmed, you also didn't give me steroid as well. So it is very important. You missed it, okay? So it is very tenderness. You have to add here steroid as well. So according to the painkiller, antibiotic, steroid, as it is worsening nowadays, you have to add steroid as well. So spondyloarthropathy, how patient is presenting, it is important. Is it reactive arthritis? Is it disc prolapse? Do I need surgery, surgical decompression? According to the presentation, doctor, you have to proceed.
Hello?
Yes, doctor.
Yes, regarding his concern about do I need surgery, may I answer him like after assessment, maybe there is any complication, or during my examination there is no evidence of compression, so
Yes.
surely it is just medical treatment.
Yeah, you can say that right now as I assess you, though I have to confirm by some imaging tests. First of all, I do X-ray, then if needed CT scan. It depends according to your presentation and the finding. If needed, it will be, this decision will be taken care by our multidisciplinary team. This word multidisciplinary team, you are talking with the examiner. He's a doctor, right? So you have to tell this with the multidisciplinary approach. If needs surgery, it will be after getting the result. We'll meet another meeting with you after full evaluation. So no question, right? The back pain scenario, doctors, very important PACES scenario, which we commonly face in our exam, ankylosing spondylitis, reactive psoriatic. Very common is common. So best of luck for all of type 3 candidates. Thank you so much. Thank you for the session.
Thank you.
Thank you.
Thank you.